Hey, everybody. Please feel free to come in and put your camera on as you are comfortable. So we're going to ask that you, for Candace's sake, if you could put your name and jurisdiction into the, including your state, if you will, and indicate if you're, we know you have an E-MDT. Do you also have a coordinated community response? And then let us know. So go ahead and put that in the chat. And I appreciate you, Laramie, letting us know you're having lunch or a snack. I know that Laramie is expecting and needing to eat when she can. And Benita's with Red Wind, and her internet is often come and go. So Serena, welcome. It's good to see you. Serena and Stephanie are our 2021 grantee class. So the new kids. Bernadette in Georgia, Nancy in Baltimore, and Laramie also in Georgia are part of the 2019. Okay. Laramie and Nancy have both been a part of the OVW grant that they've done.
Not to worry, Benita. We understand that you may have some internet interruptions.
All right. I'm anticipating that for those who weren't glued to your phone or internet, we're sending thoughts to the United Kingdom. The Queen has just died, and so we send our thoughts to them and to the world as that plays out. And so I imagine there might be a few news junkies and Anglophiles who are checking the news right now. But let's go ahead and get started. Anna, you want to introduce us to this that we're thinking of as the Enhanced Multidisciplinary Teams and Coordinated Community Response Conversation. So we really want to talk together rather than Candy and I talking at you. Anna?
Yes, welcome everyone. Just a short disclaimer before we get started that the opinions, findings, conclusions, and recommendations throughout this webinar are those of our contributors and presenters and do not represent the official position or policies of the US DOJ. We've seen this before. And just a short welcome. We're really happy you all could join us today. This is going to be a great conversation. Just a couple housekeeping things. You all know the drill, but engage in the way that you feel most comfortable with, whether that's using the chat or raising your hand. There will be time to talk in small groups as well. So if you have any questions about breakout rooms and what that looks like, just shoot me a direct message, but those will all be set up for you. Those will be quick as well. There's going to be some time at the end for questions as well, but we have two wonderful presenters, which I will turn it over to now, and we can get started to be respectful of your time. Welcome, everyone.
So good afternoon or good morning. My name is Candace Heisler, and I'm speaking to you from my home in the San Francisco Bay Area. I'm really delighted to be talking to you. Some of you I already know from the OVW grant or from this particular grant, and I have done a few other presentations. By way of background, I'm a retired assistant district attorney from San Francisco. My more recent work has been working with a vast array of professionals and communities around the areas of elder abuse, domestic violence in later life, and the intersection of abuse in later life. Lisa, do you want to introduce yourself, or does everybody already know you?
Yep, these folks know me fairly well, though professionally, I've been working in abuse in later life for about 15 or more years. Domestic violence, sexual assault before that. I've worked for local nonprofits, for a university setting, for the Attorney General's office in Virginia, and for the NCAL, the National Clearinghouse on Abuse in Later Life, and now back to a local nonprofit. So real mixed bag there. And I've done in all of those, I've done multidisciplinary teamwork and community organizing, community building. And so I live and work in Richmond, Virginia. For those of you that don't think I sound like Rochester, New York, you would be correct. So we're gonna work together today, and it's good to see y'all in a different capacity. So Candy.
Thank you. As we move into this material, you were previously sent a case study. If you could make sure that you have it available to you as we work through the material, we will put a link to it in the chat if you don't already have it, but be sure to locate it and have it available because it will frame a lot of our discussions moving forward.
So Anna just sent it out to folks.
Thank you. So I want to start with some context. Dr. Rosalie Wolf, who some of you may already know and some may not, was an early pioneer and visionary in the development of the elder abuse field. And this is long, long before there was general agreement that an effective elder abuse response requires collaboration. And so this statement, which goes back to sometime in the 1980s, really does start to frame our discussions. I think if she had thought about it, she would have added a ... that said, but nobody said this was going to be easy. And so today we're going to talk about some of the places where it may not be so easy. In terms of, next slide, in terms of just thinking about the context for this session, E-MDTs are really intended to foster a seamless response across a community in responding to elder abuse. And in doing that, to create a system that is victim-focused, victim-centered, and victim-friendly. These are typically, in terms of their work, anchored in case review teams and case review functions. And you will see that makes them different from coordinated community responses, or CCRs. When we look at teams across the nation, while there are general goals that most share, teams do have variability in terms of rules, applicable laws, principles, membership, and other goals they may set. And E-MDTs, and some of you are in these communities, may coexist in a community that has not only the E-MDT, but also the coordinated community response, or CCR. Going forward, I'm just going to say CCR. Next slide, please. So in our conversation today, these are the points that we want to discuss with you. We want to explain and contrast both similarities and differences between MDTs, E-MDTs in particular, and CCRs. And we'll look at purpose, focus, membership, how often teams meet, and issues around confidentiality. We want to differentiate the work of an E-MDT and that of a CCR, including focusing on what kinds of issues should each be dealing with. And then we want to discuss ways to improve and strengthen interactions between E-MDTs and CCRs. In a well-run community, it is likely that you will have both. And so a thoughtful planning of how you interact with the CCRs that currently exist or may be created becomes really important to your effectiveness. So with that, Lisa, why don't you talk about definitions?
So when we are looking at the two organizations and how they operate, what we're looking at is they all have the kind of the five key components of a good organization, but those things are slightly different. The purpose, and we'll get more into the nitty gritty in just a minute, but the purpose overall, E-MDT is looking at a case review, looking at case specific, incident by incident kind of focus, the individual case. In terms of the CCR, you're looking broader. You're looking at a systems change piece. You're looking at the community, how that is, how the work is done within the community. For membership, oftentimes many of the same agencies may be included, but the roles of the folks who attend will be different. For the E-MDT, it often is the boots on the ground, folks who are responding to the individual case, the investigating officer, the detective, the prosecutor, the caseworker, whereas for membership of the CCR, you're looking a little broader. You're looking for perhaps directors, assistant directors, program managers, things of that. And then the frequency of the, with confidentiality, E-MDTs, yes, for confidentiality, because you're talking about specific case information. For the CCR, no confidentiality form is needed because you're looking at the broader concept of what's happening in the community. So let's frequency, usually E-MDTs meet more often, but not always. Some CCRs meet monthly, some meet yearly, and everything in between. E-MDTs could meet every 2 weeks as needed, once a month. Usually at that much, at least once a month, and more often, sometimes more frequently than that. So let's look then at that E-MDT's definition. Our OVC grant definition from the work that we're doing on this grant is a case review. E-MDTs are defined as a group of professionals composed of 3 or more disciplines who work together collaboratively. That being the hard part sometimes, isn't it? Bound by that common purpose, the team has a shared goal and a definition of the problem they are addressing, and it's characterized by that shared decision-making, partnership, and interdependency. So if we look at that common purpose, what we're doing with the E-MDT in that enhanced multidisciplinary teams, we're focusing on the needs of that individual client. And from the work with this grant is broad enough that each team, each community gets to set their own purpose. So for some of you, it's prosecution. You're looking at using the E-MDT to enhance prosecution, make sure the victim is safe in the community and that the offender is held accountable. In other communities, you're looking more at addressing the needs of that particular person and looking at a case coordination or case management around finding services. And in some of your teams, you're looking to do a combination of the two. So the advantage to this grant is that you're able to set the specifics of what you're doing in your own communities. And so I think that's terribly exciting. So that's what we're meaning when we're talking about a focus on that individual client, that individual case. The confidentiality statement must be signed by all participants and I would say visitors anytime someone is attending. And it's important that that confidentiality statement has been agreed upon by all. One of the things that you need to sometimes wrestle with is whether that confidentiality statement is agency specific or individual specific. And that's one of the situations that you're looking at. Different agencies have different definitions and different ways of working in different languages. And so it's important that you come to a conclusion about that in terms of your work as a whole. As we said before, it often meets more frequently than a CCR, as needed once or twice a month. And so that's what y'all are already doing. So I'm going to switch it over and let Candy talk about the CCR for a minute.
Thanks, Lisa. So a CCR is focusing on changing systems rather than addressing the needs of individual case coordination. So if if E-MDTs are on the ground, think about CCRs at the more macro or 30,000 or 10,000 level look. So they're not going to be discussing individual cases. Instead, they're going to talk about issues that seem to prevent your community from effectively addressing elder abuse. So as an example, a CCR might identify or might have identified a gap that law enforcement and APS are not effectively communicating and reporting cases in a timely fashion. Not going to be referencing an individual case, but saying, how do we build a better system so there's improved reporting and communication? A different CCR might be looking at, in our community, it's really difficult because there's a lack of emergency housing for older adults who need a temporary safe space, but don't require placement in a hospital. And so they will be looking across systems to say, how do we address and fill that gap? CCRs typically are going to engage not with boots on the ground folks, but more with decision makers. They're more likely to include community members and members who come from various diverse groups within the community to better understand how different segments of the community address elder abuse and more effective ways to respond to those needs. Because they are not dealing with individual situations, communication is intended to be open and not to be confidential. So it's really important if in some situations the person at the CCR is privy to confidential information from the E-MDT to distinguish that on the ground information about a case from how do we broaden this discussion not to be about victim A, but really to be about a broad group of older individuals or vulnerable adults who have a common need. So meetings tend to be monthly, quarterly, or yearly, and MDTs, E-MDTs can be part of the work of a CCR, so they can be like a subcommittee or a project. They may be lodged in forensic centers, and they may be part of a family justice center. Next slide, please. Now, what do these two entities share? There are things they may both do. So depending on the community, both may conduct outreach and training, especially of members. In each case, the strength of the partnership and the effort is because there are relationships that have been built between agency members and a level of trust that has come from working together and understanding each other's roles. In some instances, agencies and professions may need MOUs that explain the commitment they're making and their expectations in both community, including communities of color and socioeconomic as well as cultural groups may need to be addressed. And both should be thinking about how do we engage underserved communities as members of our either team or CCR. In both cases, if people rely on federal funds, in both cases, it is prohibited for them to use federal funded grant time to engage in legislative change. However, it is proper for both entities to educate leaders, potential legislators, or funders about the issue so they better understand it. In some situations, such as a situation where there are multiple sources of funding or where people are volunteering time, which are not covered under federal grants, there may be the ability as a body to advocate or lobby by individual members. But be aware, within both, there will be members who may be prohibited by their ethical codes from participating in advocacy. So an example would be court officials, where judges, for example, are prohibited from advocating or lobbying, even if the CCR is doing some of that effort. So judges will do a hands-off approach to those particular issues. Next slide. In a perfect world, and I'd like to meet the person who lives in that world, but in a perfect world, E-MDTs and CCRs may be staffed with members of the same organizations, but as Lisa has already mentioned, typically for the E-MDT, we're talking about the people who are the worker bees who are actually dealing with cases, while the CCR level requires more policy level staff and occasionally the direct service staff in their role of saying, these are the gaps that are constantly coming up in our community. We've already addressed how often they meet. So with that, as a background, let's look at an evaluation of the National Center on Elder Abuse Community Collaboration Project that was conducted in 2011 that looked at these different CCRs addressing elder justice. And you can read along with it, but what I'm seeing or what is highlighted for me is CCRs are more global in nature. They typically involve more people. Their primary goal is informational in nature, such as identifying gaps, educating and updating members on services, resources, and new legislation. They may be able to advocate for certain changes, and they may be conducting community training. Let's go on to the next slide, which continues the quote. And what stands out for me is that collaborations typically engage a multitude of professionals, and these include not only who's typically in an E-MDT, but elder law attorneys, nurses and other healthcare providers, elder law attorneys, financial services, retired professionals, domestic violence advocates, and other organizations that are addressing the needs of older adults. And in terms of sustainability, it recognizes that in order for these efforts to continue in a forward trajectory, they need to implement processes to accomplish the work. And these might include minutes, job descriptions for leadership and a staff person, a coordinator, how linkages are done. They may need to produce products like brochures or PSAs, and they need to be able to track interventions and outcomes. So that is a way of thinking broadly about CCRs. Lisa, let's move this along and let's talk about who's in our room.
So I know that several of you don't have a CCR in your area and that a few of you do. So Callie, I know that you're in Milwaukee and I know that y'all do have a CCR. I don't know if it's still operating or not. So how many of y'all are on the CCR? Nancy is. Laramie, y'all've got a CCR. Are you on it? No? Okay. Callie, do you sit on that CCR? Or Stephanie, y'all don't have one, I don't think, right?
No, we don't have one.
Okay. All right. And Callie in Milwaukee does sit on the CCR. So what have y'all talked about on the CCR? How it identifies issues that it will handle, and who sets the agenda for the work the CCR will be doing?
I can address what we do. I mean, I think I'm on it only because I just keep showing up. The CCR in Baltimore got so big that Jackie pulled out a little a higher level group. So it's just the MOU partners. So the MOU partners on the CCR decide what they're going to do. I think mostly it's the grantee giving some ideas back to that, or somebody coming up in one of the large community meetings with an idea that they come back and decide to do. But I think it's pretty collaborative, that the stakeholder meeting decides on what they present.
Okay.
And I'm not part of that.
You're not part of a stakeholder.
I'm not part of the stakeholders, not anymore.
All right. So let's jump ahead and do a quick poll. Are there potential issues? Anna, I think, has our poll ready for us. So the question is, if individuals are members of the CCR, and you can pick all that you would like. No issues exist, confidentiality, ignoring or not understanding boundaries, may engage in prohibitive activity that might be lobbying or doing other things they're not supposed to do, or might have a few others. So and if you don't know, don't sweat it. But if you wonder how the two interact and you're not entirely sure, that's okay too. We'll get to that.
So so these are just theoretical, not necessarily what we think.
Right.
Okay.
Are there potential issues? What potential issues do you, not that you've experienced them or anything, but based on the description of these two multidisciplinary groups, what do you think might be some issues as we're moving forward? All right, and if you put other, somebody throw one in the chat and let us know what it is. All right, almost everybody did that. So competing for funding. Yes, Nancy, you've got that. All right. Well, let's go on ahead then and unpack a few of these. Let's look at the case study. And Anna was so kind to send that back out. Candy and I worked on that a while and made it, pretty bad. But what we've got is Viva, a 68-year-old woman, and David, a 72-year-old man who live together. Their caregiver is their 45-year-old son, Frank, who is just something else. And there are concerns about possible neglect and financial exploitation. David has had some issues in the past with hearing, and might be some war issues with that. Viva has had some weight loss and some cognition issues, and ends up in the hospital, where David is able to meet her. And then we have APS and law enforcement trying to decide what the next steps are. So let's then look about how those discussions will happen. And we're going to go ahead and put y'all into some breakout rooms, and you're going to have about 7 or 8 minutes to address the issues. Let's go with 8. I think they could do 8. And if that works, 8 minutes. And then the questions that you'll be addressing in group 1 will be: how and what does the E-MDT communicate to the CCR? And how does the CCR learn about systematic problems or successes from the E-MDT? So if this is the case that you're looking at, what information from that you would gain would you want to send to the CCR, and how would you do that? And then group 2 is going to be looking at what barriers are there to the communication between the E-MDTs and the CCRs, and what are some ways those barriers can be addressed. And again, we're going to focus on the case study and some of the issues that are involved in that case. So Anna, when you're ready, folks will jump into the small groups, and then we'll need someone to, oh, thank you. Anna's putting the info in the chat for that. And then we will come back together, and we'll need a reporter to do the report out.
All right, I will see you all in 8 minutes.
All right, welcome back, everybody. We'll just wait a minute. Let me just ask, group 1, did you identify a spokesperson?
Yeah, I think that's me, Candace.
Okay, Nancy. And group 2, did you come up with a spokesperson?
I think I kind of I think I stepped into it. Let's just call it for what it is.
You got voluntold?
But not even voluntold. I think I just put myself out there.
You know what? For this discussion, as short as it was, we're grateful that somebody stepped forward, because there was so much to discuss and no time to do it. And what I would actually say is, some of these, if you're new to CCRs, this is, you could take the same case study back to your groups and have the same discussions with the larger group and educate them around the differences in some of the places that people can get into trouble if they're just not if they haven't thought this through. So Nancy, I think the questions for group 1 is: how and what does the E-MDT communicate to the CCR? And how does the CCR learn about systemic problems or successes? What sort of ideas did your group come up with?
Well, I have to admit, I sort of shared what we do. I guess my partner didn't have a CCR. we have people who coexist on both groups. So in the meeting, we will identify if we're going too far afield from the case, we will identify in the meeting to the CCR leader who sits in on the team to say, this sounds like a good topic for the CCR. And we do that, I think, for two reasons. One is to create that boundary and end the discussion, but also to sort of populate their list of things they can do. So we'll do it right in the meeting. And if that weren't the case, I guess one idea we came up with was just to designate somebody on the E-MDT team to be that reporter back. And the example we chatted a little bit here about was that just in the last paragraph of the case where their APS questioned why the hospital, blah, 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 in that meeting, and to say that, to identify that as a training CCR issue and to suggest that go back there so that questioning in the past, and people being defensive wouldn't happen at the meeting, but rather as going forward in a training. So I hope that's sort of, so we could identify in the meeting, or we could create a liaison and say, you should call so-and-so who's the CCR person.
So if I'm understanding, and I think you're exactly on point, you already have identified someone on the CCR who attends your E-MDT meetings sort of as the CCR liaison. And their role is to take issues back. But in the absence of such a designated person, you would designate someone on the case review team to report that general issue or that more systemic issue back to the CCR.
Yes.
Okay, I think you're on. I think those are really good, very simple things and very clear things, as long as each of those individuals who's going between the systems understands where the boundaries are. So thank you. Let me turn, is there anything else Group 1 discussed that hasn't been discussed already? Anything further that came up in your very brief discussions?
I think we're good.
Okay, that's great. Thank you. Great ideas. Well done, Group 1. Okay, Betsy, in Group 2, you're thinking about barriers to communication between E-MDTs and CCRs, as well as ways that the barriers might be addressed. So what ideas did your group come up with?
So really what we did is our group discussed what CCRs really are and how they function, because while Laramie's community has a CCR, she's not as familiar with it and hasn't had an opportunity to be a part of it. And Bernadette didn't really, she was still trying to learn about CCRs and how they function. So one of the things that we talked about was there's an interesting sort of intersection of the two, that they can sort of start from one another. So like in my experience, our CCR is what morphed our E-MDT into being, which is great. But then some of the barriers and some of the downsides to that is that there are issues with boundaries, like in the poll, that oftentimes people don't necessarily understand what their role is on that E-MDT versus the CCR. So I used an example of a team that I worked on, that we would have members of the CCR inviting members to that meeting, and then they would have them stay for the E-MDT, completely misunderstanding the point of the E-MDT, that this was a specific case review. So there was a lot of communication that needed to be had on how we did separate the two, but yet still work together, because many of the cases that came from our CCR went to the E-MDT, and we needed their input and their insight. So as far as specific to the case, we did not get there. We were talking about other aspects of CCRs and how those two things work. So I apologize for not leading the group in a better direction. But
no need to apologize, because frankly, the discussion you had really does address some of the issues that are in the case study, including recognizing how you establish boundaries, and this idea of some, it may be beneficial for efficiency of time that you schedule the E-MDT and CCR meetings on the same day, ideally not at the same time, because that's going to prevent people from attending who need to be there. But it also allows enough separation that the people who don't belong in the E-MDT can finish their business or arrive later or before and attend to the CCR business without getting mixed up in the more confidential business of that E-MDT. So very
And one
useful.
thing too that Laramie pointed out is that one of the things that her CCR had worked on was, a bigger picture issue, but it was going to impact the E-MDT cases probably that came through. But as an E-MDT, they obviously wouldn't have been able to address those. So that's sort of that nice macro versus micro approach to addressing that issue.
And I think the case study gives you a number of those CCR type issues, pretty meaty issues that arise. So you've talked, Nancy identified some of the reporting issues. Others were APS can't get a capacity evaluation done. How about concerns about a system that appoints someone with a long criminal history who is dealing actively with substance abuse to be a caregiver for frail parents? Law enforcement being understaffed and lacking expertise in how to even do these investigations. So there are a whole variety. Those are just some examples. There are actually even more that represent some of the issues that really aren't the work of the E-MDT. If what they're focusing on is how do we make this a better environment for Viva and David, maybe how do we address some of the needs of the caregiver through different options, but not these broad issues that are going to be more community level. So was there anything else that was discussed by either team before we move this along a little bit and talk about ideas? Okay, I'm not seeing that there is. So let's go to the next question, which is really thinking about what are some ideas you have, well, whether on the case study or triggered by the case study or in your own experience, what are some ideas you could suggest to some of the people here who are less experienced working with CCRs for how to improve interactions? And if you've had a good experience and effective outcome in your own community, would you kindly share it? Nancy, go ahead.
But I know that, having had that grant, and then I have this grant, the whole CCR, E-MDT, that means something to me. But it doesn't mean anything to anybody else. And I think it would be a good idea for people to think about calling the groups a name that means something to people, or not being afraid to. And I remember this from Linda in Denver, calls her group something else, and it like made so much more sense than calling it the E-MDT. And like I work in an agency, we run MDTs on children and trafficking, like every day there's an MDT going on here. But no one else in the mental health world knows what I'm talking about. I mean, they know what an MDT is from working in the health field, but it's not a thing the way it is to us. And so, case review team or, the community program for elder safety or elder justice. I don't know. I just find that would work better with politicians and other stakeholders who aren't the grantees.
I think that's a great suggestion, and probably isn't so very hard to implement. But it helps, it would follow a discussion by members about what is it we do and what are our values and principles that could be incorporated into a name, possibly also a vision statement, so that people can quickly identify, oh, yeah, that's the group that I need to work with for older adults, as opposed to turning up on the very important problem of trafficking, but it's less relevant. Well, it's not totally irrelevant, but it's less focused on some of these other systemic gaps. And by the way, your trafficking MDT might need to be talking to your elder abuse MDT or CCR, because they will have overlapping matters. And having a liaison or having an education session to educate one another could be very productive.
Mm-hmm.
So thanks for sharing that. Any other ideas? Well, I think Lisa has been quiet far too long. And with her vast experience, I suspect she's got some other ideas. So Lisa, what are your thoughts?
So some of the ones that we've kind of listed out, and Nancy, I think that's really good. Your statement, it almost falls into our propensity for jumping into jargon when we don't need to, when everybody starts throwing all the initials around and you're playing alphabet bingo at some of these meetings. But some folks have done that by calling it the elder abuse case review and the elder abuse task force, or something along those lines, that differentiates between the case focus and the community focus. And so that's something that's very important. One of the things that we think about is that each of those two groups have different educational needs in terms of the coordinated community response. Will be talking more about the issue itself of elder abuse and its impact on the community, because that coordinated community response is looking at the broader picture of systems change. The elder abuse case review is going to be doing less community-based education and more specific to cross-training with agencies. And so the CCR might be training social workers and law enforcement to respond to the problem. The E-MDT is saying, this is the problem and here's how you need to refer those cases to us. We've heard from y'all multiple times about the difficulty of getting cases to the E-MDT. And so part of that training is not only how they address the investigation of the issue, but also how do they bring that case to the team. As Nancy's group highlighted, you want a liaison between those groups, and that person has got to be somebody who understands the boundaries between the two and understands the difference between systems change work and that individual case issues. Policies for going back and forth. It's imperative that the work of the E-MDT get referred to the CCR, but the CCR can kind of go off on a tangent without keeping in mind that the work of the E-MDT is important. If the CCR is doing some big community event, the E-MDT team needs to know what that is, so that they can encourage their agencies to be there, or things of that sort. And so that's really important. but I'm not sure how I got on that. But when we're looking at the policies around that liaison, around the how that information is communicated, if you think in terms of, I don't know if any of y'all have sat on some fatality review teams, where oftentimes, you've got a number of folks looking at that fatality and addressing the issues that came from that and looking at it. Oh, thank you, Betsy. We're late. Then what we're looking at is, who's writing that report to send it on. And then, make sure you're not meeting at the same time and things of that sort. So let's move along briefly. We've got the resources that you'll have, and some of the websites that we've got. Let's quickly do any questions you have, and in 3 minutes to 5 we'll be done. So for anybody that's got to jump off, if you can give us another few minutes. What questions do you have? The main thing we want to leave you with is that it's really important for communities to have both of these teams. It's imperative that those two teams talk to each other well. So what questions do you have moving forward that we could answer while we have one of the nation's authorities here, and to be able to pick her brain?
This is Bernadette. I do have a question. Are there particular grants or funding streams out there to start CCRs?
That's the grant that we've been talking about with y'all applying for the OVW training grant.
Oh, okay. Okay.
That also has funds in it for the CCR work.
Okay. Thank you. We did apply for that, but I didn't hear back yet. So.
Yeah, I don't think you would yet. Probably the end of this month, or they should be reaching out. So the OVW grant on elder abuse training grant is one that Nancy and Laramie's and Callie's communities have all had, that is able to address CCRs and has some victim service monies on it, as well as training for law enforcement prosecutors and advocates. It's a good grant to have, following up on this one, or this grant following up on that one, either one.
So I have a question about that. So we have a hospital in a rural county, which is not far from Baltimore. It's adjacent. I've done both grants, and I don't know how I would answer this question. If, we'd like to encourage that county to jump into the, abuse in later life world. Which one do you think is best to start with? If you're only going to get one, which way would you say, in your experience, which way to go for first?
I would say it truly depends on where are your advocates in the work. Which agencies? Is it more individual workers who are those advocates, or is it more of the director managers who are the cheerleaders for the issue?
Interesting. Okay.
Candy,
Yeah.
what would you say?
Well, I'm not going to sound very different. I think it depends on the existing relationships and where's the energy around pursuing the grant, as well as what are the perceived weaknesses and strengths in that community. So if a huge weakness is training law enforcement, and perhaps training prosecutors and judges, then I would be looking first at the OVW grant, because that's clearly its focus. And I don't think it's a bad thing to develop a new CCR that can then guide the development of an E-MDT. But if you don't, if that isn't the perceived need, or if existing partnerships can't be built for the key 4 stakeholder MOU partners, then you're not ready to apply for the OVW grant, because it won't go anywhere if you don't have those key players committed. So I don't know if that's helpful, but that would be my perspective.
No,
And I would say
that
one
is-
other
thank you.
thing, if the community isn't sure about relationships, then I would urge it to spend this year developing those relationships and commitment, and looking at old proposal requests, because they don't change that much, and figuring out how they would respond and where are their strengths and weaknesses within those collaborative relationships and or ability to answer the questions on the RFP. I've said to communities, you're just not ready, much as you'd like to go in. So spend this time before the grant cycle comes around again, building the relationships and being ready to apply.
All right, any other questions? All right, thanks so much. So we've got, on the 14th, we've got the touch point with Juanita and Katie, though I think Katie's not going to be able to be there next time. So we'll see y'all next week. And this is our contact information. Don't forget to fill out the survey. We really look at those. And y'all know how to contact us. Please reach out for anything that you need. And my sincere thanks to Candace Heisler, giving of her time and always her wonderful thoughts. So thanks so much for that. And we'll see y'all later.
Good luck,
Thanks,
everybody,
Candace.
and thanks for being with us today.
Thanks. See you, Lisa.
Thank you.